have head injuries, guaranteed. They are at the wrong height for everything. They don't look where they're going, they dash around, they are head heavy. They go through different stages, so you've got your little one there and they haven't shown the slightest inclination to roll over, and you leave them in the middle of the double bed and you nip to the loo and you're gone 2 seconds, and during that time they learn not just to roll over once, but twice and maybe 3 times, and you hear an almighty clunk. Been it, done it myself. What we're going to cover is when it's really, really serious, and when it's that sort of grey area, what we're looking out for how long and when and why and all that. So if you have somebody that has come flying down the stairs and they've landed at the bottom and they've got watery blood coming out of their nose or an ear, and instead of a big lump coming up on their head, they've got a dent and that has watery blood coming out of it, they have a skull fracture. Okay? Very, very serious. Fortunately, comparatively very rare. If they're conscious, you keep them completely still. You grab something sterile, or as sterile as you possibly got, and you would just apply gentle pressure over that wound. Don't give it a full whammy if the bit of skull is loose. And you would get an ambulance on the way. Keep them warm, keep them as calm as you can, and keep them still. And remember to support their head and neck as well, because if they've fallen down sufficiently to smash their skull, the chances of them having a spinal injury are still pretty high. I mean, it was a bit daft when I'm just doing this with a baby, but if you imagine we're dealing with bigger ones. If they are losing consciousness or drifting in and out of consciousness, or they are unresponsive but breathing, what are you going to do?
Recovery position.
Yeah, straight away. Which side?
The injured side.
Onto the injured side. So you would very, very carefully roll them into the recovery position. Keep checking that they're breathing. You get an ambulance on the way. You cover them to keep them warm. If they are unresponsive and not breathing, CPR. And we said before, for a baby or child, you would do 1 minute CPR before you phone for an ambulance. Not this time.
Okay.
So you're going to start straight away. You know exactly why they're unresponsive and not breathing, so get an ambulance on the way. Okay?
And then CPR.
And then CPR, well, you put it on speakerphone.
Yeah.
And you'd be carrying on. Right, that is your most serious. If a baby or child is knocked out, even for a second or two, I would be phoning an ambulance. They're likely to be absolutely fine, but get an ambulance on the way. To be cautious, it's not your child. If a child is sick once after they've had a nasty head injury, that's pretty normal. Kids are sick when they hurt themselves. If they're sick more than once, something not quite right. I would get it checked out. Right, what you're worrying about with head injuries is compression. We've all had concussion, you bang your head, you feel sick, you feel dizzy, you think, oh my goodness, I'm going to die. And after a little bit, it all goes down, you think, I'm going to be all right. That is reversible brain damage. What happens with compression is that your brain swells. All injuries swell, so that's completely normal. But if your brain swells, it can only push against other brain and against your spinal cord. So you start seeing signs that something isn't right. And that's what you're looking out for. So that is compression, and it can happen immediately or up to 48 hours after that bang on the head. So you are looking out for anything unusual. And you are looking after children that will be going on a journey from parents to school to childcare to nanny to whatever, all the way through. And everybody needs to be aware that that person, that child, hit their head. So that if later on in the afternoon they're sitting in one of your lessons and they start dozing off, you don't take it personally. But you think, oh my goodness, they did hit their head earlier. I'd better check they're okay and talk to them and find out what's happening. So you take it much more seriously. Think Natasha Richardson. the actress, she banged her head when she was skiing and she died. If she had had somebody with her, they would have seen some signs that something wasn't right. They would have seen that maybe she was suddenly having double vision, maybe she had a weakness down one side, maybe she started fitting, maybe she started losing consciousness, maybe she went back hypomanic. It can change your mood and your behaviour. Anything unusual, sudden really sharp pain, something would have been an early indicator. And if they had then been able to get somebody on the way, they could possibly have operated, taken the pressure off the brain, and it would have been a different story. We'll never know, but that is why they shouldn't be left on their own. What you're looking for is compression. You're looking for signs that anything is unusual, so altered levels of consciousness, anything different.
So could you say that if you banged your head, you should go to hospital for observation?
They used to. They used to admit everyone as a sort of routine, and we used to have them overnight, and every 15 minutes, and every half an hour, and then every hour throughout the night we used to be asking them silly questions, shining torches in their eyes. Yeah, you've done it too. Doing all that, and how many signs of compression did you see? I didn't. We had one possible, which turned out not to be. So most of the time, it isn't. Yeah? So you can look out for it. You can make the decision yourself. If you've got a child that has rolled off the sofa, or they've fallen down the stairs, and initially you went running out, and they were winded, and they were floppy, and they weren't their usual colour, and they were very quiet, you'll probably phone an ambulance. While the ambulance is on the way, you'll probably find they regain their normal colour, they start breathing properly, because they were just winded by it, and they start to cry. All the good signs. The paramedics will then come and they'll check them over, they'll check speak to them. Obviously we're talking bigger people than this. They will see if they're making sense, if they're with it, or if their eyes are all over the place. Is there a weakness down one side? Are they fitting? Head injuries can cause fitting. Are they twitching strangely? Are they looking like this child normally is? They'll shine torches in their eyes. Do the pupils constrict equally and swiftly? Anything unusual, they will take them to hospital. They will usually take them to hospital anyway with the child once you've called them. But you can assess those things yourself. So if you have a child that has rolled off the sofa and it wasn't that big a bang, they've got a lump on their head, but it really wasn't that spectacular. They weren't pushed with force, but you're worried about them. You check them over. You check the colour, check the breathing. Yes, they've had a really good scream. If it was the time that they would normally be having a nap, so long as you are completely happy that they are like they were before they banged their head, you can let them have a short nap. But you check on them, you check on their colour, you check on their breathing, are they twitching strangely? Is there anything I'm not happy about? If you're not happy, you rouse them gently. If you don't get a response, the usual settling down response, you wake them completely, and if you're still not happy, you try and wake them totally, and if not, you get an ambulance on the way. They should sleep in the same room as their parents for the next couple of nights, and the parents should be doing the same. So any strange noises they're making or anything, they should get up and they should rouse them. Is that okay on head injuries? Is that enough to keep you?
So in school, I have to call every time a child falls down and basically hits their head. I have to call the parents and just inform them, and that's so that they can keep an observation on later. Yeah.
But so many kids falling down at the moment because they're walking.
Yeah, it happens. But most of them do not have major problems. You're also covering yourself as a school.
Yes, exactly.
Yeah. And you're filling in an accident form.
Yeah.
And that is also to make sure you are covering yourself. And you should as well be giving out something to the parents that tells them what to look out for.
Yes.
So something that tells them, because otherwise they say keep an eye on them, they go, what am I looking out for?
Yeah.
So it tells them the specifics that you're looking out for the next 48 hours. And they need to be getting them to hospital swiftly if anything changes.
Yeah.
And tell all the other members of staff as well.
Yeah.
So yes, lots of people to tell.